Okay, yes. So, greeting and assalamu alaikum, everyone. My name is Dr. Sami Atiq. I'm a graduate of King Edward Medical University, batch of 2020. I graduated back in 2021, and after that, I have cleared my PLAB-1, PLAB-2, and I have also passed MSC's Part A. And with my PLAB-2 journey, I'm also done with the clinical attachment in UK. Currently, I'm applying for the jobs and taking some interviews nowadays. So me and my team decided to conduct a teaching course for all of you. The purpose of this PLAB-2 teaching course is to make an affordable and make a free of cost teaching course for everyone for the PLAB-2. So we will be covering all the topics we mentioned in the group. You have the list in the WhatsApp group. So today we will be starting with the introduction to PLAB-2. What is PLAB-2? So me and my team today, my colleague Dr. Atif will be with me, and he will be taking you through the initial slides, and then I will take back over from him. So Atif, can you please unmute yourself?
Hello, assalamu alaikum. Can you hear me?
Yes, Atif, I can hear you.
All right. So, everybody, my name is Dr. Atif Anwar, and I'm a graduate of King Edward Medical University. Right. So, I'll be here telling you about the PLAB-2 Part 2. Okay. So, just give me a few seconds to recollect everything. All right. So, let's talk about the PLAB-2. So, from the GMC's website, they tell you that PLAB-2 is an OSCE exam which tests how you apply your clinical knowledge to real life scenarios. So there will be situations like real life consultations, and there will be like emergency scenarios in the exam, and they will test your knowledge, your communication skills, and the way you can manage things during the exam. So what does it consist of? Stations in the exam. So 16 of them are exam stations and 2 are rest stations. Sami will be telling you about the structure of each station afterwards, but let me just brief you here. So each station has 8 minutes where you will enter the station, complete your consultation, while you will have some waiting period, which is like 90 seconds outside to read the scenario. So let's just talk about when the exam is conducted. So PLAB-2 is conducted around the year, like it is conducted 5 days a week or 3 to 4 days a week throughout the year. So you do not face any problems while booking the seat. Okay, so there are 2 venues about PLAB-2 where the exam is conducted, which are in Manchester. It is conducted only in Manchester, UK. So you'll have to travel to UK to attempt the exam. There are 2 venues there. One is Hardman Square, and there is an Hardman Street. Well, there is just a little bit difference between both the venues. Like at Hardman Square, you will have the rooms which are pretty much close to each other, and there are less video consultations, less audio consultations there. While in the street, the rooms are a little bit apart, so they will give you more time to walk between the rooms, and there you will have more like video consultations and audio consultations. Uh, from the GMC's website, they tell you that the time between 2 stations in at Hardman Square is 90 seconds, while in the street, they give you 1 minute and 45 seconds to move between the stations, and then you will have 8 minutes to complete your stations when you walk into the room. Okay, so other people, can you tell me if you're hearing me clearly?
Atif, are you saying something to me?
Can you hear me? Sami, can you hear me?
Yes, I can hear you. There's a little bit distortion in your voice, but we can hear you.
Okay, let me just close my video and then let's see if the internet connection gets stable. So while we have just discussed the exam venues and the dates about exam conduction, so let's break down how we'll book the seat, how we'll attempt the academies, and how we'll move to UK about the timeline. So the first thing you need to keep in mind for PLAB2 preparation is how much time you will estimated need. So in my case, I gave it 3 to 4 months for preparation while I booked my exam seat. So I just took academic classes, practice for 2 to 3 months, and then I moved to UK for exam. About the dates to travel to UK, you will need to decide how quickly you can practice the exam stations. Like some people take 1 month to practice the mannequin and all. Some people just go there 2 weeks before the exam. While in my case, I went 3 weeks before the exam, which I believe is an ideal time period because you have practiced all the 60 stations beforehand, and when you move to UK, you will just move to academy physically to practice the examination stations, the mannequins, the simulatory mannequins, and attempting your mock exam. So keeping in mind your exam date, I would advise that you should take approximately 3 weeks in mind. You should keep 3 weeks in mind when you're planning your trip to move to UK before the exam. So visa period. About the visa application process, we'll guide you later, and we'll also make a separate video about visa application and clinical attachment procedure. But let me just brief you here a little bit. Me, and all of my friends, we applied for visas ourselves. We did not contact any agency or any agent. So we just applied on the website for the visa. The ideal timeline you should keep in mind before applying for visa is you should apply online at least 3 months before your exam date, which is the finish period, because from the date of your biometrics, they take average 4 to 5 weeks for processing of your visa. But the dates can vary according to the situation. Like around New Year, they can take more time to process your visa applications. So you'll have to keep in mind everything. Okay, if I just let me turn off my head. Okay, so can you hear me now clearly?
Yes, your voice is better now.
All right. So we are talking about the visa application process, which I said that generally the standard visa application, you should start your application around 3 months before you plan to move to UK, so that there is no delay in the visa processing, and your trip, you do not have to change your ticket dates, or you do not have to change your plans. The average time they're taking these days is 4 weeks, which can change according to the situations. Like around New Year, they can take more time, and around other days they may take just 3 weeks. In my case, I received my visa in about 20 days. So I would, however, to stay on the safe side, I would advise you should apply at least 3 months before you plan to move to UK. Okay, so about the next thing, the clinical attachment. Well, these days it's very difficult to even find clinical attachments. So you have to start applying now so that there is chance that you can get an attachment around your exam date. I prefer doing a clinical attachment just after my exam, so that I do not have to travel again for just a clinical attachment. So I started applying in November while my exam was in March. How do you apply? You have to contact the consultants in the UK's hospitals. Well, when they approve, they send your CV to their HR to approve your attachment, which is a quite hectic process because most of the times you do not even get the replies from the consultants. So you just have to keep going. You have to keep sending applications for emails every day, so that there is a chance that some consultant might approve the clinical attachment, and then it can be a good luck for you. So how do you email or contact the consultants? Well, there are two methods. We'll even share a file of the emails of the consultants from UK with you in the group. So you can contact them through your email. And the other method is make an account on Track Jobs website, which is a website for job applications in UK. From the Track Job account, you will have to search for jobs from various specialties. And when you open each job, you will find an email of the consultant or the HR at the bottom of the job advertisement. So you will collect that email, write a paragraph about your introduction and your exam dates, attach your CV, and just send them that you want to do a clinical attachment in their department when your exam is over. So that is the whole process of clinical attachment application in brief. While we'll make a video separately and we'll update it on the YouTube channel of Sami. You will get more details from there. Okay, so
Thank you, Dr. Atif, for your valuable feedback. So
okay.
for the next section, I will be taking over and will be guiding you about the exam basics. So let's start with the exam basic. As Dr. Atif already told you that it's an OSCE exam and it is conducted in Manchester only. And there are two basic venues. And the basic difference between the two venues is that one is the Hartman Square and the other is the street. Basic difference is that the street gets more video calls, more audio-visual stations as compared to the Hartman Square. And Hartman Square is an old exam center and it's comparatively shorter, and the rooms are quite closer. So let us now go through the exam basics. You don't need to know about this. What was the criteria before the COVID? This is the criteria you wanted. So there is a total of 18 stations in the exam, out of which 2 stations are rest stations, and other remaining 6 stations are the stations which you need to do performance. The 2 rest stations will be divided. You may be starting with a rest station or you may be ending with a rest station. They are almost in the middle of the exam. Okay, so it's about your luck if you're starting with a rest station or ending with a rest station. So the minimum criteria that is needed to pass the exam is 2 basic criteria. You need to pass minimum of 10 stations out of 16, and also you need to get the minimum average score that is needed to pass the exam. And this minimum score varies from exam to exam, depending upon the exam difficulty level, depending upon the station's difficulty level. So now, what is the marking criteria and how are the marks distributed among the station in the station? Each station carries a total of 12 marks. And the 12 marks is divided equally into 3 parts. 4 marks is for the data gathering, 4 marks is for the management, 4 marks is for the interpersonal skills. We will go into details of each section in our upcoming lectures. We will teach you how to take effective history, how to tell effective management, or to develop your interpersonal skills. We have a separate lecture on this very topic. So I already told you there are 18 stations, 16 out of which are the real stations, 2 are the rest stations. Now for the time for each stations. Inside the cubicle time is same on both the venues. It's the time which is outside the cubicle that varies on the 2 venues. On the square, it is around 1.25 minutes. And on the Hardman Street, it's 1.5 minutes because it's a long distance between the rooms and you need to travel. There will be on the exam day, you are aligned outside the rooms, outside the cubicles, and you will be asked to start the exam. There will be no bell. You should start reading the scenarios. There will be first bell, which will be meaning to enter the cubicle. And then there will be a second bell, which will be at 6 minutes, telling you that only 2 minutes are remaining. At the third bell, you have to leave the station, whether you have completed it or not. You have to move on to the next station. So a total of 2 hours and 50 minutes are required for the whole exam to be completed. So as I already told you that, now let us take a look at how the exam is marked, or the feedback is given to you, and how the marking is done. So Here's the list of stations. There are a total of 16 stations, 2 other rest stations. And this is an old picture, so these 2 stations will not be there. 16 stations will be there. You will be scored separately for the data gathering, management, and interpersonal skills. So look, if you score maximum marks in both these skills and still not able to score well in the management or not able to score well in the interpersonal skill, you want to be able to pass the exam. So you need to score a minimum passing score in order to pass that particular station. Look, you can easily look here that passing score is different for each station. Some stations are being passed at 5.38, and some are 7.98, some are 9, some are 8. So it varies depending upon the difficulty level of the station, also depending upon the difficulty level of the exam and the performance of the people on the day of the exam. So this second picture can give you an overview that how you are marked. All different things are important for to score a good thing. Like these skills are being tested. Your consultation is being tested. Your diagnosis making is being tested. Your examination is being tested. Your findings are being tested. Like if there's a combined station, you need to diagnose the things. You need to tell what are the findings, what are the positive findings. And after that, are you addressing the issues properly or not? Is your language appropriate? Is your English language appropriate or not? And thirdly, your listening skills are very important. This matters a lot in your IPS. If you're not listening to the patient, you are not going to get good in IPS, because you will only be in a hurry to complete the station, but you will not be listening to the patient, because sometimes it happens that we just try to complete a station without listening to the concerns of the patient. And for example, in my exam, there was a case of a child with a chicken pox, and the mother was there. Initially, my initial perception about the case was that the mother is here with the concerns regarding the child, that my child is suffering from chickenpox. How should I be treating him? But as I discussed the case with the mother, she was more concerned about herself. She was more concerned that she is again pregnant and she might get chickenpox, and it might be harmful for the upcoming baby. So if I wouldn't have discussed it, wouldn't have listened to the concerns of the patient, I would have taken the case in an entirely different direction. So listening is very important. Management is important. Rapport building is also very important. You have to start the case very well. If you make a good impression in the start, you will be able to finish the station in a better way. Time management is also extremely important. We will be giving detailed guidance about each of the steps during our upcoming lectures, about the history taking, about management, about how to build a rapport, about how to manage the time. Now, the most important part of my lecture is telling you about a general scheme, that how the stations usually come in the exam. So if you know about this general scheme, you will be able to give due importance to the topics that are needed to be studied during the exam. You will not waste your time in unimportant topics. You will know what you want to do, or you can pass the exam smartly. And so the general scheme the GMC follows, it can change, but the general schemes which has been observed over the time is that following cases come in the following orders. Like there is 1 to 2 cases of prescriptions that come in exam compulsory. So if you go through all the prescriptions, there are almost 20 to 22 prescriptions, and practice them repeatedly and make them accurate according to you and according to your resources, you will be able to score well in this exam, and your one station is safe, and you will be able to pass that station without any hesitation. So practicing prescriptions again and again will guarantee you at least 1 station in the exam. Next comes the teaching stations. There are a number of teaching stations. I will be going through the list in the next slides, and you can take a screenshot from that. If you prepare all the teaching stations, you will be able to pass another station, because 1 teaching station is compulsory in the exam. It has to come in the exam. So 1 is the teaching station. Another 1 station is the SIMMAN, which are the topic mannequins, which are the acute cases. This is also a compulsory station in the exam. Apart from this, there are 1 to 2 combined stations. Now, what are combined stations? Combined stations are like those stations in which you have to take the history. You also have to examine the patient. Like in nowadays, due to the COVID, we don't examine the real life patients. There are mannequins inside stations. So we have to examine the stations, give our findings, and then come back to the patient for telling him the diagnosis and management and all the stuff. So two stations are combined. So if you are doing your procedures, you are doing your teachings, and you are doing your combined stations and prescriptions and symptoms, if you cover these 2 to 3 topics, you will be able to secure at least 5 to 6 stations in your exam. Now, almost remaining stations are almost 10. So out of those 10 stations, there are 5 to 6 stations that belong to the section of ethics or counseling stations. Now, ethics and counseling includes the medical counseling, any kind of counseling. There are different sections as you will start your preparation. There will be different sections according of the cases you will be practicing. So there will be a section of counseling, there will be a section of ethics. In ethics, there will be a breaking bad news, there will be dealing with an angry patient, dealing with a medical error. All these come under the headings of ethics. And similarly, there are stations of counseling, like a mother wants a counseling, a child wants a counseling, LGBTQ counseling. All these stations come under this heading. So in our exam and the stations I have observed over the period of time, there are almost 5 to 6 stations that belong to this category. So these stations make a major chunk of the major chunk of the exam. So you have, after these stations, or even before, if you start preparing for the ethics, you have to give due importance to these stations. So if you prepare these, make your preparation till this, you are good with a good amount of 11 to 12 stations. Remaining stations are 4, and a lot of topics are still remaining. Like there's peds, there's obs and gynae, there's psychiatry, and a lot of other history-taking medical scenarios and surgical scenarios. So 1 to 2 stations are compulsory from peds, obs, and psychiatry, and other 1 to 2 stations are the regular history-taking. It can be from the cardiology, it can be from the respiratory system, it can be from endocrinology, and all the other topics. So the purpose of this slide is to tell you the importance of each station. Like, prepare prescription well, prepare teaching, SIMMAN, combined station, ethical, and counseling. You will be good to tackle at least 12 stations. Then give importance to all of the topics, which includes a hefty amount of topics of peds, obs, gynae, and psychiatry, and the other history-taking stations. So after this general scheme, let me tell you about what are the examination stations which will be coming. So you can take a screenshot or take a picture of this slide, or we can note it down simply. So there it is. There is now examinations, these stations that are examinations, procedures, and the teaching stations. These are kind of overlapping stations. If you prepare one of them or 2 of them, you will see some stations are overlapping. Like in examination, there is an abdominal examination, respiratory, antenatal, gynoscrotal, testicular examination, rectal examination, eye examination, ENT, ear examination, breast examination, shoulder, ankle, rectal examination, and pap smear. Now, as you guys already might know, that these stations do not come separately in the exam. These stations come in the form of combined stations. Okay. First of all, like you will be having a complete scenario. You will be asked. You will be asked about these stations. You will be asked about the station in such a way that you will be given a complete scenario. You will be asked to, like in my exam, I had a case where a patient was alcoholic and he was having swollen abdomen, and he was having liver problems. His LFTs were deranged, and I was asked to take the history and examine the patient. So I was asked to perform an abdominal examination along with taking a history, along with making a diagnosis, along with doing the relative investigations and diagnosis, and then the management part. So in these cases, in these combined stations, you have to make sure that you manage time effectively. You are able to manage time effectively because an extra portion of examination is added in this type of scenarios. I was short of time in my exam, and I was not able to tell examination. I was not able to tell the examination completely as I was short of time in that. So, but still, I was able to pass the exam as I was able to tell tell the management a little bit about it. So you have to manage time accordingly. Like similarly, in all the cases, in eye exam, you will be given a scenario. In ENT and ear exam, you will be given a scenario, and you will have to perform each and every step along with the examination. Whenever you enter a cubicle, you have to look around. If there is a mannequin there in the room, it's not there without any purpose. There has to be any examination on that. Anything present in the room is there to be used by you, whether it be any instrument, whether it be any mannequin, whether it be any chart or any kind of this stuff. You have to look around carefully. These are the examination stations. Now let me walk through the procedures. There will be at least one station about the procedures. It can be IV cannulation. It can be venipuncture. It can be about the ABGs, subcut, catheterization, urine dipstick, and pap smear. As I told you about the examination stations, same goes with the procedures. These stations don't come separately, like go inside the cubicle and perform this procedure. It will also come in the form of a combined station. For example, if you are asked to perform an IV cannulation, you will be given a complete scenario that there is a patient admitted in your ward, which is not well. There's a patient inside your ward, admitted in your ward, and he's not well. He's having pain, and his IV cannula is blocked, and you need to go to talk to the patient and change the cannula and give the painkiller medications appropriately. So the scenario will come in this way. You have to take a short history and about 2 minutes, and then proceed with the procedure part. It's the main part of your station, and you will be performing the cannulation part of your station. After that, there's a venipuncture. After that, you have to perform venipuncture. Similarly, the venipuncture comes in the form of the emergency station, and there is a patient, for example, with a paracetamol overdose. You don't have to simply go in the station and perform the venipuncture. There will be a complete scenario that the patient came with a paracetamol overdose. You have to perform the venipuncture. You have to take a little bit history. You have to see where are you in the exam setting. If you are in the emergency or in the psychiatry. If you're in the psychiatry ward, you have to take the psychiatric history. But if you are in the emergency, you have to take a brief history that how many tablets, over what period of time, with what thing, and have you vomited or you feeding now. Only these few questions, and then proceed with the venipuncture procedure. You will perform the venipuncture, take at least 2, 3, 4 minutes, and perform it and send the labs, and the examiner standing there will give you the reports straightforward. And you have to assess the reports there. Like in the case of paracetamol overdose, you will be asked to judge that if the patient's level of paracetamol is above the treatment line or below the treatment line. Accordingly, you have to decide the further management plan and have to guide the patient. Same goes with the ABGs, subcut injections, catheterization. There will be a complete scenario for the catheterization, urine dipstick and pap smear. There will be a complete scenario. You can take a screenshot for these. These are the procedures that come. Now, these procedures also overlap with the teaching stations. Like, look, respiratory, abdominal examination, testicular examination, gynostotal examination, dipstick, subcut injections, ABGs. You have already covered this in the above sections if you have gone through that. So these are also covered. The only stations that are limited to the teaching station is the ECG, which is not in any of the other sections, and EpiPen teaching, BLS child, BLS adult, and these 4 stations are only those stations which are exclusive to teaching. So you have to learn them separately. One teaching station is compulsory, so prepare them well. There's a complete scheme of that. We will try to arrange a lecture on that too. So apart from this, there is another section which is a talking mannequin. In the case of talking mannequin, There are a number of stations. There's a list of the station. Mostly these stations come 99% of the time. And with this changing scenarios, of course, and there's an asthma. There's a complete pattern of how to deal with talking mannequin patients. There's to asthma, you have to complete the ABCD approach, manage the patient. And similarly, their talking mannequins will be a mannequin. It will look like it's a living mannequin, like there will be a heartbeat, the chest will be moving, his eyes will be moving, and the voice will be coming out of the mannequin. And in the mannequins, there will be a monitor attached to it, whose reading will change according to your management. Similarly, there will be a crash tray, there will be a trolley. All the steps you don't only have to verbalize here. You have to perform the task practically. Like if there is a patient with asthma, you have to attach the oxygen. You have to give him the nebulizer. Not only have to verbalize it, you have to do the steps practically. If you are attaching someone fluids, hang the fluids. If you are giving someone IV cannula, you have to take out the IV cannula from the tray, and then you have to hand it over to the patient, put it side to the patient. Same goes for all the mannequins. We will also try to arrange a lecture on these two in detail. So after you have gone through all these stations, let me tell you a little bit, as we have a short of time, I will tell you a little bit about the preparation strategy, that what can be your preparation strategy. Try to go through all the cases, try to attend our lectures, and try to go through those lectures from any of the notes you try to prepare. It can be any notes. There are a lot of academy notes that are available. You can prepare from any notes. Personally, we prepared from Aspire and Samsung notes. And after that, you have to study well each case, learn each case, its management, its steps, as we will be teaching you with the time. And after that, you're done reading with all the stations, start practicing. Start practicing again and again each station to build your flow, to build your scheme of exam. And after that, for the practice, what you have to do is you have to set a timer of 7 minutes for the practice. Don't go for the complete 20 minutes practice timer, as it will train you to complete the station effectively. So this will be about the preparation strategy. And after that, do give mocks and do try to repeat the stations over and over again. Right. So we have a few minutes remaining. I would like to ask, if you have any questions, do let me know, please. If you guys have any questions, do let me know, or we will be ending the session in a minute or two. Okay, so there's a question about how many days before the exam should we ideally move to UK. So most of the people move to UK at least 3. Myself, I moved to this UK around 1 month before the exam, but I won't suggest that. 3 weeks or 2.5 weeks are enough, depending upon when are your mocks, how many days are those before your mocks. So 3 weeks is a safe time to arrive in UK. You can use 5 to 6 days initially to practice in the academy. I personally went for 3 days to the academy to practice on the mannequins. And apart from that, then after that, I took the mocks. And after the mocks, I went for my exam. So 3 weeks is an ideal time to arrive in UK, and 2 to 3 days is enough for academy practice, and then your mocks, and then you will be good to go for the exam. So there's another question about another question about the recommendation about the travel, and book your flights as early as possible. So to get a cheaper flight, try to book indirect flights so that you get a cheaper rate. If you're talking about Pakistan, the cheaper flights are from Karachi and Islamabad. And from accommodation, people try different things. I personally booked an Airbnb, but it was quite expensive. There are cheaper options available. We will try to share some of the accommodation options in our group. There are Airbnb, there's some locals, and there are different websites which people use. And we will try to give you the reviews of each accommodation. And from where do we get the notes of the scenarios? Okay, there you can easily find them in online groups. Different academies have different group. I will try to share the notes which I have. I have the notes of Aspire, but you can easily find the Aspire notes